is when my brain gets cooked.
Yeah.
What about breast revision after having 3 kids and
That can be the first question.
Say, you need a consultation.
yeah, exactly. Cool. Let me do the little. What is up, everybody? It is Dr. Barrett, and we are here in Beverly Hills. I'm going to adjust these a little bit so you can see more of the palm trees. Pretend like you're here in Beverly Hills. If you're not, in Beverly Hills. So, all right. So, you guys, this is an Ask Me Anything conversation. Where's everybody coming from right now? Where's everybody? Brazil. Hello, Ani Op. What is up, you guys? We've got MRB. Share more boobs. I like your content. Will do. I've had 2 babies and thinking about a tummy tuck. Do you recommend BMI is high at 32? Jazzy and Senius, you know, the worth it rating for a tummy tuck is about 97%. So yes, I do recommend a tummy tuck. It is almost always a win-win. All my patients are very happy. Danette Mason, New York, Wets in the house. We got Vegas, we got Pakistan, we got Texas, we got Spain, Nigeria, Louisiana. I'm headed to Berlin for the Berlin Marathon, so I'll be in Europe. Maybe we'll do something there when I get over there in Europe. Your feed is very quiet. All right, hold on. Let me adjust this. That's why my microphones are down. Let's fix that. Thank you. Chattanooga, Tennessee, Oklahoma, surprise, Arizona, Maine at heart. Interesting. Botox, yes or no? Absolute yes. Fix my face, please. I'm funny. What's wrong with your face? Burleson, Texas. Hi from the UK. Antarctica. Sarah Gassani, I don't believe you. Are you really in Antarctica? You're going to have to send me a picture on my email and prove it because I don't believe you. Okay, so the purpose of this is just kind of a freebie, quick one. A lot of you guys want to ask a lot of general questions. So here you are. You're actually sitting in the consultation room in my office right here in Beverly Hills. And this is the view that you would have, and sometimes with me here in the room where we can kind of go through your consultation. So do I do mole surgery? Yes, I do mole. I just did a mole right now. Born and raised in Maine. I went to Portland they had a swim run race there, Odyssey swim run race. And I was in Portland and I had a lot of fun. The kids had a great time. The water was beautiful. But I would swim from island to island and they had like a shark up there, which made it a little more entertaining. That just like bit a woman up there in Maine. And so we had to do the race the next day, which was interesting. But anyway, what's the time frame from fully recover from liposuction? Well, it depends on how much area is a liposuction, but generally it's about 7 days. But you get a lot of swelling that lasts for about six weeks, and then full results are not until about 6 months for liposuction. Portland, Maine, Ruby. I was in Portland, Maine, not Portland, Oregon. I'm sure Oregon is really pretty too. I've never actually been there. I've seen a lot of pictures, so I have to check it out. How hard is it to get into medical school? Well, depends if you want to get into MD school or if you want to get into DO school. MD is a lot harder than DO school, but it just keeps getting harder and harder and harder. But I wouldn't suggest medical school so much anymore because I feel like the practice of medicine is a lot harder. You're dealing with insurance companies that are taking advantage of doctors, residency programs taking advantage of doctors. A lot of people are really burnt out. They're not really happy. I'm happy I'm in plastic surgery, but it was a long road to get here, and it was really, really hard. I had to get 2 standard deviations in my board scores to actually even get into residency slot. So it's not just getting into medical school. It's like, all right, get into college, okay. Get into medical school, okay. Now I've got to get into residency, right? And you got to keep jumping through these hoops. And what if you don't get into the residency you want to get into, right? So that's a lot of things. All right, so question from Morocco. Does the fat come back after liposuction? So imagine your body has fat, right? So like, let's say we do liposuction in my abdomen. Let's say there's 100 warehouses of fat there, okay? We take out basically 75% of those warehouses. You still have 25% of those warehouses, and they can blow up or they can shrink down. So yes, you can still get fat to come back after liposuction if you're gaining a lot of weight. My recommendation is be at your normal stable goal weight prior to liposuction, get your liposuction, and stay there. But if you do gain weight back, it's less likely to come back in the area that you got liposuction. So that's something to be aware of. It's a myth where it comes, you get weird things all over your body. It doesn't. If you gain a bunch of weight afterwards, you're going to get fat. So that's just what it is. Okay, I have essential thrombocytopenia, thrombocythemia and leukocytosis. Would a tummy tuck be safe? So, Kaketcher, you're going to have to check with your hematologist on that one. Your leukocytosis, if your white count's too low, it doesn't make sense to do any surgery. And how bad your platelet counts are, that's just going to depend. You know, we can always transfuse platelets prior to surgery, stuff like that, but you're going to really have to want this surgery to go through all those jumps and hoops and go through the increased risk. There could be a risk of increased blood clots as well, but you got to check with a hematologist. What are your thoughts on non-invasive procedures like cool sculpting? They're not good. Okay. I get a lot of complications from cool sculpting. I've seen people leave applicators on too long, too cold. It actually burns the skin. I've seen shark bites. I've seen bad results from cool sculpting, or I've seen like results that are just not what people expected. I feel like people are oversold on it. It takes about five treatments to make a difference. It does kind of work a little bit though. It does kill the fat cells, but you're relying you're trying to fit a round peg in a square hole, in my opinion. Liposuction, I'm able to kind of contour and get rid of all the fat, and it's one treatment. Costs are probably just not that much more expensive than it will take to get 5 rounds of cool sculpting. So, don't like it. Does it work? Yeah, in some cases it does. So yeah, I'd say there's some other treatments out there like Thermage and Venus Legacy that have radiofrequency skin tightening that kind of I think works a little bit more safe, a little bit better. How often do you do revisions on breast dogs where the first surgeon didn't size an underfilled one? Not that often. Most people come in, they have a revision for something else like capsule contracture, or the pocket bottomed out, or they are unhappy with the scarring. I occasionally get some people that want bigger breasts from the implant size, and that we take care of that. So when is too young? Someone asked, when is too young for a facelift? And you know, we've been kind of pushing, I have at least been pushing the age back for facelifts later and later, because a lot of the minimally invasive things you could do. I do a no scar neck lift. I do a lot of Botox and minimally invasive stuff for the face. CO2 laser, Renuvion. These things can kind of tighten up the skin without having to get the facelift incision. So yeah, people are typically allowed in their late 50s now or 60s getting facelifts versus like early 50s, late 40s. So we have a lot of other options, and I think if you do good maintenance and you take care of yourself throughout your life, try to avoid a lot of sun damage. You're less likely to need a facelift, and avoid weight gain, weight loss, that little yo-yo. Okay, do intermittent fasting, heal your gut, stay away from all that crappy food out there and processed food. Okay, that should be the first thing you get rid of, all processed food. Okay, how long is a nose job recovery? Well, it depends. If the full Monty, where we break the bones and everything else, you're looking at 2 weeks of like bruising and swelling. Swelling will continue up to a year sometimes in the tip, especially for open rhinoplasty, but you start to look normal by 6 weeks. No scar neck lift, please explain. So it's a combination of liposuction in the neck, Renuvion, which is a J-plasma tightening underneath. Okay, so it tightens up, and I also do the jawline. So if you have little jowls that we previously treated with a neck lift, it tightens that area up, and then we finish it with a CO2 laser, and then we follow up with Venus Legacy radiofrequency tightening later. So it's a lot of the advantage without a scar. A tiny little dot here, but that's about it. Do I perform liquid rhinoplasty? Yes, I do. I did one yesterday. Turned out great. What else? What are the questions we got here? Lots of people joining in here.
How long is no job recovery?
Oh, I just did that one.
Okay, perfect.
Do you do arm lifts? Yes, I actually just did arm liposuction today on a patient. Check out my social media, drdanielbarrett.com. I'm sorry, at Dr. Daniel Barrett on Instagram. Okay. Check out my YouTube, Dr. Barrett Plastic Surgery on YouTube. I actually have a video on arm liposuction, but I actually did one today and I filmed it. It's going to be on my stories. So check out, make sure you follow me on social media, Dr. Daniel Barrett. And then, of course, if you're on my Instagram and you want to check out cool TikTok videos that are just more fun and hilarious stuff, then check out Barrett Plastic Surgery on TikTok, okay? Okay, another question here. How long have you worked with Dr. Lee? Dr. Lee, we've worked about a year now together. So He's fantastic. He is trained at the same institution, and I've been mentoring him, and he's fantastic. We're pretty much equal now at this point. Daily habits that help you avoid needing skin treatments, procedures, preventative Botox. So I think the weight gain, weight loss is an important one. Lowering the inflammation in your body. There's different ways to do that. You can take some supplements and things like that. Fish oil is a good one. No drinking. Stop drinking. Drinking is just poison for your brain. You know how they say like a glass of wine is good for you a day. Well, they came out and said no, that doesn't exist, and I agree. I just feel stupid every time I have a glass. I mean, like alcohol. Like you know, if you're gonna don't beat yourself up if you have a drink every now and then, but it's not something you want to do on a regular basis. Smoking, get rid of that. Sun exposure. You know, if you're out in the sun on a regular basis, you need to protect your skin. A little bit of sunlight's good. But you only need about 15 minutes of sun on 25% of your body a day to get all the vitamins and things you need, and that could be your body. It doesn't have to be your face. So there's those things, and then I would say Botox, fillers, skincare, retinol, vitamin C, two main things you need to have in all your skincare. So yeah, sounds like a boring life. Perhaps, but there are some pretty interesting conversations that you can overhear when you are sober and everybody else is drinking around you. And then you kind of learn ways, like if you're sober in a conversation, to actually have more deeper conversations and you remember them the next day. So I always kind of find that, and enlightening when you can actually dive into a deep conversation with somebody. And I certainly had my fair share of drinking when I was younger, but I just didn't realize like how kind of stupid and unnecessary it really was. But it's your body, your choice, your life. But you just asked me like, what's one way to, improve your body? What do you think of laser blepharoplasty? It works. That's fine. You could do laser, or you could do surgical blepharoplasty. I use a knife and then I use cautery to tighten it up, but you can also do it with SCO2 laser. A lot of people do that. Hi from Northern Indiana. Welcome. Okay. Favorite retinol products? I like ZO skincare. Here's the tough part is, I don't have it in here, but ZO is probably the best skincare that's out there, and you can't really get it online. So you have to go to a doctor's office that has it, or you can actually call us and order from us. It is probably the best. Like I've researched a lot of them. We even had a couple of different lines, and like this is what their box looks like. It's great stuff. It's by Dr. Abaji, and I've had their products over 10 years. It's hands down some of the best skincare. It's all medical grade. The wrinkle and texture repair is probably my favorite. It's a 0.5% retinol. I put this on every night, and it really helps take away the wrinkles and the pigmentation. So ZO, for Zain Obaji is his name, okay? I'm working on some stuff myself, but it's going to be a while, and he's got a way big head start in terms of the effectiveness of his products and experience. What's your take on popular meds like Ozempic for weight loss? I don't like it at all, period. Gross, don't do it. It causes cancers, various problems in your bodies. They're not telling you about it. You are looking for a solution in a pill, and that's not going to help you. There's things we don't even know about that medication. Like there's things we already know about that medication they're not telling you. Don't do it. It's horrible. You need to, I think you need to kind of look at like how humans evolved over millions of years, right? We evolved to not eat so much, like intermittent fasting. Like we weren't surrounded by food 24/7. You're like, oh, I can't do that. I can't intermittent fast. I have low blood sugar. Well, tough. Like do it for do it until you get used to it, and you'll see that all your cravings, your focus will be better, your inflammation will go down, and then guess what? Your inflammation goes down, your weight goes down, all this other stuff. So, and then just get out there and run a mile every day. I ran 12 miles this morning at 4:30 in the morning, and that's before I came in for surgery. So I've got 3 daughters and I work 12 hours a day. So it's like there should be no excuse why you can't get out there and do some kind of exercise. Now the exercise is not so much for weight loss. You will lose weight with exercise, but it's more for your brain, your focus, your discipline. Get out there and do something. If you have osteoporosis, if you're a woman, you got to do weight training. Weight training for your bones, cardio for your brain. That's it. Do something every day, even if it's 15 minutes. So how many hours do you IF? Oh, so lately I've been off the train. I normally will do 16 or 8. I've been training so much. I've got LA Marathon coming up, and it would be hard for me to run 12 hours at 4 in the morning and then come in and do surgery. So I have been breaking my fast early. I did a 5-day water fast just before Christmas this past year. I do that every year. I do a 3-day water fast once a quarter, and then I try to do some intermittent fasting a couple of days out of the week. Now that I'm a little bit different because I'm training so much and it's more of an athletic thing. It's probably not the most healthy thing to do, but you know, humans didn't evolve to eat 3 meals a day. We never had a refrigerator, right? So like you're lucky if you got 1 meal a day. So your body needs that, and it's like it didn't make sense to me. It's like, okay, well, more food must mean it's better, but what you probably don't realize is that the food in your gut, it doesn't give your gut a chance to heal, right? So you have all this inflammation in your gut, it doesn't get a chance to heal. It's constantly working nonstop, and then that leads to a lot of problems and you know, leaky gut syndrome going into the rest of your body. Okay. All right, we'll get off that topic because I know you guys have some more fun topics to talk about. Yes, dinners with Bridget. Hi, Bridget. Yes, I still ride my bike in the morning. It's not very far, but it is kind of nice because even though I have an electric car now, it doesn't take long and it's fresh air and it's actually faster. So it's like the time it takes me to get out of my damn garage with the car, I'm already halfway to work on the bike. So you know, that's what I like to do. What else was I going to say about dinners with Bridget? I had a question for you, Bridget, later. We'll talk about you later with some questions. Okay, can I make my shoulders more feminine? Yeah, you know, if your shoulders, sometimes you can do a little bit of liposuction here. You can do a little Botox in the trapezius to kind of slim that down. It just depends on what the issue is. If it's muscle hypertrophy or if it's fat excess, there's some things we can do. I've been a surgeon for 10 years, Maddie, and going on strong probably at least another 10 years. I like it. I probably do it to the day I die if I can in some way, if I'm safe enough. That's why I work out so much. Treatment for scleroderma. So you can use Botox. If you, a lot of times if you have scleroderma of the face and for fingers and stuff like that, if you get ulcers in your fingers, you could inject Botox in the joints of your fingers so that it relieves some of the effects of scleroderma. And then also in your skin, but that, you know, you got to look at the root cause of what's causing your scleroderma. It's typically gut related. So there's 2 products I recommend for everybody. These products kind of healed my gut. I have like 30 food sensitivities when I first started doing this introspective dive into gut health and alternative medicine. Just so you know, I'm a Western trained medicine doctor. Aced med school, learned everything, but we learned everything about pharmaceuticals, which is just kind of a small piece of the puzzle. You know, I was like taking Advil and everything else for headaches, but that causes leaky gut. I didn't know it at the time, and so I did a lot of things to heal my gut. Intermittent fasting is probably the biggest thing, and then I started taking digestive enzymes and this product called Biome Breakthrough. Okay, these are not my products. I wish they were because they're brilliant. Digestive enzymes helps break down, decrease the immunogenicity in your food so that the food particles don't go in and cause a big immune reaction in your body. They also help with healing during surgeries. That's why we have it. And then Biome Breakthrough has IgA Max, which is a special immunoglobulin that heals your gut lining. And then it also has probiotic and prebiotic in it, which is really important. So these are on my website, postoprecovery.com. I recommend them if you're going to have surgery, especially breast augmentation, to lower the chance that you can develop some kind of autoimmune reaction to implants, okay? Which is rare, by the way. Any suggestion for hypopigmentation? Everything is geared towards hyperpigmentation. So user 550440129. So that is a good question. Your hypopigmentation is because your body is attacking your melanocytes. So you need to figure out why your body's attacking melanocytes. Is it gut health? So that's what you need to figure out. All right, got a couple more questions. Can I do something for my turkey neck? Yes. I have a no scar neck lift, so this was something that I do, and the website's being built out, so it's not ready yet. It'll be soon, I hope, someday. Okay. Basically, we combine liposuction with Renuvion and CO2 laser and Venus Legacy to tighten up the skin without surgery. We can certainly also do a neck lift. I do them. I do deep plane, but if you're younger, you don't want to quite commit to surgery and have the downtime, then let's do the neck liposuction and the other procedures that we do for our no scar neck lift. Is my face asymmetrical or is it just the iPhone camera? Your face is probably asymmetrical. Like if you look at my face, I have one eye that's higher than the other. My nose is crooked. You know, I've got various things. Most people's faces, including supermodels, have asymmetrical faces. All right, couple more questions, and we're gonna have to sign off because I got to do some TikToks. How would you go about fixing an asymmetrical face? I really wouldn't. Most faces are asymmetrical, and if you try to chase it and make symmetry, you're going to end up making it look weird. So I just say no to that. An asymmetrical nose is a different story, but faces are asymmetrical. You know, there's not really a whole lot you could do there. Reconstructive of chest after male breast cancer, that's a tough one. Okay, I do a lot of male chest reduction. But when it comes to reconstruction, there's local flaps that you can do, there's fat transfer that you can do. Just really depends on what the issue is. I have Poland syndrome. Any thoughts on pec implants? Do you have experience with other patients? Yes. Do we have pec implants here? Yeah. I have a pec implant. Little do you know. Yeah. This is a buttock implant. We got lots of buttock implants. That's a pec right here. Boom. So it depends if you're male or female. We can do different things, but yeah, we do have pec implants. And I do have experience. You make a little incision over here, put it in, boom, there you go. You can do it one side, you can do both sides. So we also have various buttock implants for various looks that you're trying to achieve. I typically use the round ones, which are these, in case they rotate. It's not a big deal, it doesn't look funny. But of course, my favorite thing to do is a BBL, fat transfer procedure, versus using an implant. I think that's the most natural way to go. Can I work out chest 2 years? Breast augmentation post-op, absolutely. Why not? How do you fix cysts? Well, you have to remove the cyst. You make a little incision, you kind of enucleate the cyst, and then you clean it out, and then you close it up. How long to wait after lift to get implants? Well, that depends on your doctor. I know you can do them both at the same time. Some people like to wait 3 months to do that, and I think that's a safe amount of time. Getting a rhinoplasty, who's best advice to less swollen blue eyes. Thanks, doctor. I would take some arnica. We have our arnica coming out very soon. When will it be here? This week?
It will be launched end of this month.
End of this month, we're going to launch our arnica. So recommend to take some arnica after your rhinoplasty procedure. Don't take it before because it can cause bleeding, okay? I do recommend to change the implants every 10 years. You can get an MRI if you're worried about it. Implant rupture risk is very low until about 10 years, and then it starts to go up. So I recommend you swap them out at 10 years. If you're worried about it before, then get an MRI, but those MRIs are expensive and so forth. Can I water fast for 5 days? I wouldn't water fast for 5 days unless you've water fasted for 12 hours. Start 12 hours, see how you do. Build up your tolerance because your body can rely on 2 fuels, carbohydrates, ketones. If you're used to be relying on carbohydrates, and that's most people, that's all they're used to relying on, all of the machinery, all of the proteins designed to metabolize ketones, especially in your brain, they're not upregulated. So you have to, it takes several days for those to start to be upregulated for you to start to feel more normal and sane without getting the tunnel vision, sweats, and everything else. So I wouldn't start with a 5-day fast. It'd be too much. I would just start with 12 hours, and then start with 24 hours, and then just kind of slowly work your way up. All right, guys, that's it. So if you want more information about these products, postoprecovery.com. We have CBD. We have our CBD balm. We're going to have our arnica over there very soon. And all this stuff is designed for those of you who don't want to come see me. I won't take offense, but you can still use the products and still recover like a champ. All right. Also, drdanielbarrett.com for our website. If you want a virtual consultation, drdanielbarrett.com. You can fill out the information, send in your pictures, and we can get back to you. Follow me on YouTube for the detailed stuff. And I have a podcast called The Natural Plastic Surgeon. Podcast, Natural Plastic Surgeon. If you want some detailed information about certain procedures, it's all right there. Everything you need to know about liposuction, everything you need to know about breast augmentation, it's all there, okay? And then more cool videos on my YouTube page, so make sure you subscribe. And Dr. Daniel Barrett on Instagram, where you can check out that arm liposuction we did today. Of course, if you want the fun stuff, Barrett Plastic Surgery on TikTok. Okay, thanks, guys. I'll tune in next week. We'll go live again. We'll see you next time and get to the rest of those questions. Thank you so much.